Despite the efforts of the national government to implement the universal healthcare program, the gap between Kenyans who are able to afford quality healthcare services and those who are unable to afford it is widening. In its finding, the National Bureau of Statistics has noted that poverty is the main challenge towards the achievement of universal healthcare services. As one way of dealing with this, Health Cabinet Secretary Susan Nakhumicha has announced plans that will drive her team moving forward in ensuring that they implement the positive side of the report.
My ministry is spearheading the government's commitment of accelerating the attainment of universal health coverage. To optimally do this, the use of relevant and up-to-date data is a key requisite to enable evidence-based decision-making.
On the National Health Insurance Fund that has reported a low uptake, CS Nakhumicha has noted that she will continue cracking the whip on members of the board for them to facilitate service delivery to Kenyans.
This data has provided a good background for reforms at the National Hospital Insurance Fund as we structure how best to implement universal health coverage through primary healthcare networks. Actually, Professor Ndungu, now I have the confidence to stand and say I must clean up NHIF.
To the finance part of its implementation, the national government allocated 141.2 billion Kenyan shillings in the 2023-2024 financial year to the health sector, although from the findings of the report, there is a lot to be covered. While responding to this, National Treasury Cabinet Secretary Professor Njuguna Ndung'u has said that the government will collaborate with the Ministry of Health in actualizing the findings of this report.
Ladies and gentlemen, let me assure you that the government, through the National Treasury, is committed to allocating more resources, and I dare add, when they are available, to programs that will improve. Let me say, I am a realist. I don't promise things that are not there. So more resources, once they are available, they will be allocated, and that will help us improve the quality of life for the Kenyans.
With now the report at hand, it is the responsibility of both levels of government to implement its findings. Jackson Chacha, TV47, KICC, Nairobi County.